Hi, I'm Joe Sawyer, the Superintendent of Schools here in the Shrewsbury Public Schools, and this is another edition of Superintendent's Update. My guest for this episode is Representative Hannah Kane. Representative Kane was elected in 2015 to the seat that represents the town of Shrewsbury, as well as a couple of precincts in Westboro, and thought it might be good for viewers at home to be able to hear a conversation about issues related to public education that are going on at Beacon Hill. And I know that we've had a lot of different interactions to the school department with Hannah and her work at the State House to represent Shrewsbury and Westboro, and our interest in public education, of course, is a key interest in Massachusetts politics and government. So welcome, Hannah, to the show. Thank you for being here. I thought we could start off with just really thinking a little bit. You've certainly been heavily involved with public education here in Shrewsbury as a PTO officer at Floral Street School, advocate for our schools in a variety of ways, one of the leaders of the Override campaign a couple of years ago, and taking that experience and now having been for a year plus on Beacon Hill, how did some of the experiences you had locally influence the work that you're doing at the State House?
Sure. Well, as you know, I grew up the product of two educators,
right.
So have been involved in public education for a very long time. And when my first child entered Floral, got very involved in the PTO there. And then when we had the opportunity to build a new Sherwood facility, worked on that initiative, as well as the override, and also on the years when the budget was tough and we formed the garden party group to have fun with that. So, you know, I come at education both from understanding sort of the teacher and administrator side of it, as well as the user and the parent side of it. And one of the things that's always been important to me is that when we are talking about education, especially in Beacon Hill, we're doing it in a manner that really reflects the goal and responsibility of education in our communities, but also on Beacon Hill, our responsibility to make sure that we're appropriately funding it. So one of the things that I said when I ran was it was really important to me that we made sure that if we were mandating something out, if it was that critically important to be mandated, that we were putting the funding behind it.
Right.
But also, you know, my father was a superintendent for many, many years on the public side, then went to the private side of education, and, you know, so had a 20-year gap from public to private and came back in. And he always used to tell me that, you know, when he left going from the public side to the private, he was the chief educator in a community. And when he came back in and became a superintendent again, he really became the chief administrator. Mm-hmm. And that really speaks to the role that you have today, which is unfortunately not as focused on education as 100% of the time we would like it, because there are so many responsibilities in terms of balancing sort of the lack of resources that we have to devote to education overall. So, you know, I go into it with a premise that I want to make sure that we are not overly regulating what we're requiring our schools to do, and that we're also not taxing them in a way in which, you know, we're saying you must do this, but we're not providing the funding for it. And so you as the schools and then you as a town have to deal with it. And I tell people, you know, I vote on both a state budget and I vote on a local budget, being on the finance committee in Shrewsbury, and also as a town meeting member. And so, you know, I feel that dual weight of responsibility every time I'm evaluating something on Beacon Hill, and especially as it is education related.
Well, maintaining those roots locally at the same time really does give you that dual perspective, which is really important. When you mentioned about your father and that shift over time, and that's something that I know even from when I first entered the superintendency in Shrewsbury to now, just the number of mandates, the number of requirements. There's no doubt I would like to be out in schools more than I am, but there seem to be a myriad issues that we have to deal with. We have from the Department of Elementary and Secondary Education, a superintendent's checklist that runs like 9 pages of very small print of all the various mandates that we have to make sure, reports and that sort of thing. Could you talk a little bit about, I know there's a bill that you've worked on and supported relative to studying the mandates that have accumulated over the years to public education in Massachusetts. Maybe talk a little bit about that initiative.
It's something that was really important to me. It's the Educational Mandate Task Force, Unfunded Mandate Task Force. And the goal is to look at the laundry list of things that have been required over time. And they go from the silly and ridiculous to the quite serious, and really evaluating, what of those mandates should still remain? Are there any that have either passed the time that it made sense to ask? Some were never should have happened. Unfortunately, there really isn't a litmus test for things. You have to get just a simple majority to pass something, and over time, that means that some things have happened that really aren't important for either an educational perspective or from a reporting perspective, that it simply becomes rote. It becomes something that we require school districts to do, but it has no ultimate value to anybody. And so the goal of this is to look through those mandates, see what could be sunsetted and no longer have to deal with, and also begin to understand what is the financial impact of those mandates on the school districts and on cities and towns. Auditor Bump did a good report that just came out at the end of December, and it talked about the number of mandates that had been put on cities and towns. And I think of the 95 overall, 23 were specifically for school departments, and they were some of the more expensive ones that had been mandated. And so, when you do things on a one-off, you don't sometimes sit back and realize how much they are hindering our school departments from really focusing on the core job of educating the children. And I think this is an opportunity to do that. Now, on the side that I get worried about in it is whether or not we'll actually affect the change that we write about. So I am sure there's going to be at least 2 hearings that are held, public hearings, and I am sure we will get enormous feedback from folks like yourself. I just worry that, it's not enough to just simply come to a conclusion with a report. We actually have to have the will and the wherewithal to implement that report. And right now where it stands, it was a budget amendment that we did. So the House has put it in their budget. The budget will now be debated in the Senate in the next couple of weeks. Hopefully the same language will be included on the Senate side. Then it will go to a conference committee. Assuming it's the same language, I think there will be no issues in whether or not it comes out of the conference committee. And then it would go to the governor's desk. And I feel very strongly that is not something the governor would use as line item veto on. It actually mirrors some of the work that's being done on the municipal modernization. Bill is looking at streamlining what cities and towns have to do to comply and getting rid of unnecessary rules and regulations that are out there. So I think that this will be something they'd be extremely supportive of.
Right. And my hope would be that perhaps the report could create some sort of framework that's simple enough to be clear that here's some action that could be, and some pathways to action, because that ultimately, a lot of these mandates, and it's understood, well-intentioned. Oftentimes, in my experience, they come from some hot issue that is of importance to the Commonwealth, and the legislature wants to be sure that it's seen and taking action and doing something about it. And then, as the issue du jour becomes the next issue du jour, and then all of a sudden these things start to pile up, and it becomes regulatory wise very difficult to have the means and the resources to comply. And as you said, if you're generating reports but you're not really sure the data is really being used for anything meaningful, it just becomes an exercise as opposed to something that is really useful to helping educate kids better.
And sometimes it's even how you have to comply with something or how you have to report on it. It's not like you enter information once and it populates multiple areas that are looking for the same information. And that, I know, is, again, one of the pieces that if you were required to do all these things and yet you entered information once and it went everywhere, then that would at least streamline it somewhat on your end in terms of the school department. But we don't even do that. We don't have that sort of mechanism there. So, part of it, I think, is continuing to move towards being more technology savvy in terms of reporting end of things, and part of it is simply getting rid of things that just have no value and they aren't looked at, or there's nothing that happens when this information comes. And to me, that's unfortunately a large majority of what is being reported in on. One of the other things that I'm hoping that they'll look at is also looking at reporting by the level of school that you are. So if you're a high-performing school, which is sort of hitting all the benchmarks educationally that we're looking for you to hit, then perhaps there is a lessened reporting requirement in certain areas than in other schools that may be failing or in trouble, and you need to have a little bit more hands-on approach in terms of understanding some of the data that's coming in. My hope is that that's something that we would take a look at as well. Right.
I recall that when the Department of Elementary and Secondary Education made application to the federal government for the waiver under what was then No Child Left Behind Act to get some relief from certain aspects of it, the language that was used was that we shouldn't have these one-size-fits-all pieces, and if there are school districts that are performing well, they shouldn't be required to provide the same level of documentation or be under the same level of scrutiny if there's a strong track record and evidence of success. Ironically, at the same time, there was another mandate that came down the pike relative to educating students who are English language learners around training staff. And this, in all fairness, really came from a federal mandate to the Department of Justice. But it became, probably in my career as superintendent, it was the most onerous in the sense of just complex. And for a district like ours, where we have excellent results with our English language learner students, it's a relatively small population in our district, yet it was a very much a one-size-fits-all mandate for every district in the state. And I think of the amount of hours of work time that administrators have spent working through that issue over the past 3 or 4 years. That's an example of the kind of thing that maybe we could avoid in the future. So I certainly appreciate that piece and hope that the task force meets with some success relative to those pieces. You mentioned budget being such a critical aspect, of course, of what's happening, and maybe I think we could look at this in kind of a macro and a micro way. There was, the past year, the Foundation Budget Commission did some work around looking at, well, the formula was established in the early mid-1990s, really was out of sync with a lot of the things, the realities of today, and came up with some recommendations. At the same time, there are a lot of things that are not part of the Foundation Budget Chapter 70 formula that have a big impact on local budgets. One, which is an issue I know you've been very specific about and advocating for relative to a line item in the budget around non-resident vocational transportation. Maybe if you could try to tie that, the sort of the big funding issue together, and then talk about how these very specific things can make a difference if they're not commitments that the Commonwealth made at one point, and then they're not making them anymore, and how that puts us in a bind.
Sure. So the Foundation Budget Review Commission was really looking at 4 cost drivers that were out of whack with the experience that cities and towns were having in school districts. It was the health insurance piece and also the retiree health insurance piece, the special education costs, the English language learners, and the low income piece. And 2 pieces in particular that they most focused on the earlier side of things were the healthcare costs and the technology, as well as the special ed. And in healthcare, I mean, we know that again from the town's budget, the cost of healthcare it's grown exponentially. And back in 1993, the early 90s, when the formula was being developed, it didn't take into full consideration how that was going to escalate. No one foresaw that was going to be such a huge, and also the retiree cost, which is something again, which is a financial burden. It's a promise, but it's also a burden in terms of the future generations, and how do you make sure that you're accounting for that properly? So that piece was enormous, and then the special education cost was again an area, with 20 some years difference from the time that this was worked on to now. We've certainly realized a lot more about how to better help folks who are in a case where they require special education services, but also the cost structure of those things have also grown. And so those 2 things alone are somewhere around about a $500 million hit in terms of being out of whack with what the true costs are for school districts versus the reimbursement and funding formula. When you add in English language learners and low income, that pushes it to about $1.1 billion. That is fundamentally missing. A lot on the state side, but some on the local municipality side as well in terms of funding. So the special education side, and I was grateful to have you give input not only when the Foundation Budget Review was having their hearings around the state. I think the first one got snowed out last year that you were going to. But that was extremely valuable. And from that grew an awareness on the special education costs, but specifically in Shrewsbury, one of the things that you were very good about advocating for, and I did bring out Kim Ferguson, who's the ranking minority member on the Education Committee and also was on the Foundation Budget Review Commission, because I wanted to make sure that the commission understood firsthand from our district what our experience is. In the beginning, the way that they were talking about it was really recognizing more that they needed to increase the cost for out-of-district placements. And what we wanted to really talk about was, for us, it is much, we believe the students here, as much as possible when we can keep them in district, are getting an excellent education. And it is also financially a more responsible way, because we're keeping the cost in-house and they're less than if we were sending them out. And so we wanted to make sure that the folks that were working on the commission report sort of understood that, because in the beginning there seemed to be a bias towards thinking they just needed to sort of boost and understand better the out-of-district costs that were incurred in special education. And again, the budget on the state level has been very tough, really, since the recession of 2009, and we're still trying to come out of that. And one of the things that's happened is some of the line items have had either, flat funding or no funding increases for a very long period of time. And so the Chapter 766 schools are one example of that, where they have not received really any increases. And what we've seen is instead, the other mechanism that they have for dealing with increases is coming back to the cities and towns every 3 years, I believe, and having the opportunity to say, we need to increase what we're charging you. So the pressure that the state's ignoring sort of on their cost side is coming out through the local municipalities.
Right.
And ultimately, it comes right back to the state in terms of the pressure on the circuit breaker funding.
Exactly.
And so, some of these things, while they're sort of distinct funding categories, they all are connected together. And when you're underfunding one of them, it's going to show up on somebody else's doorstep to fund. It's simply just the
because it's a
requirement
mandate,
doesn't go away.
right? Exactly,
Right.
exactly. You have to cope with it and figure that out. I know the Foundation Budget Commission, one of the points that they made was that because of the requirements to be funding special education, or because of the cost of health insurance or these other pieces, in essence, money that was coming from the formula that was supposed to be coming for other textbooks or teacher salaries, whatever it might be, that was all part of that, essentially was becoming diverted because, and then there were less there, and that's what put the squeeze on a lot of local districts as far as how that would play out. When you mention about the differences in different lines and the state's commitment and things like that, could you talk a little bit about that non-resident vocational piece? Because you're in a unique situation where you represent two different districts that are funded in different ways for the same mandate.
Correct. So interestingly, and thanks to you too, because when I got sworn in, I was right in the middle of House budget. So I'm trying to get up to speed quickly on what are the things that we can do to help certainly bring more money back to the cities and towns, but also make sure that there's a level playing field in terms of some of these line items. And so one of the ones that was extremely out of whack was what's called non-resident pupil transportation. It has nothing to do with residency. It has to do with whether or not you are a member of a regional school district, or in this case, a regional vocational school district, or if you tuition your students in like we do. So our students that go to Assabet are tuitioned in. So I think we have 3 busloads a day that go back and forth. And so unlike other schools that are members of those regional schools, they get funded through what's called the regional transportation line item. And that is underfunded itself, but it's funded to somewhere between 60 and 70% generally. The line item that we get reimbursement for, and it's important to understand that the reimbursement came in the form of a requirement that the state would require school districts to pay for transportation, but they would also help pay, in some cases, all of it, or at least a good portion of it. And that wasn't happening. The line item for the non-resident had been funded about $2.24 million, and as part of the 9C cuts that happened in the fall of 2014, that got wiped out. It didn't get filed in the governor's budget with any funds in there, so when I arrived there, when the House Ways and Means budget came out, it wasn't in there as well. So I went in and made my primary request to get that line item back in there. First and foremost, I simply wanted the line item to show back up, so I wasn't as concerned with how much money got in there, just simply that if we lose the line item in this budget, we'll never get it back. Once it's gone, it's gone. And so I was fortunate to be able to get about $250,000 in the House Ways and Means budget. The Senate was able to get more in, and out of conference it came to about $1.75 million. And again, there's about 101 school districts that get money out of that line item. In Shrewsbury, I think it was between 90 and 100,000 that we were getting. So for us, it was a significant amount of money. And that was why it was so critically important to me to make sure that line item showed up and that we were able to get funds out of that. When I went in and talked to the House Ways and Means Chairman, Brian Dempsey, who's excellent about this issue, what I really said to him is this goes back to the Commonwealth keeping its commitments. You have 2 different line items, but they're doing the exact same thing. And we're funding one at, 65, 70%, and we're funding another anywhere between 26 and 40%.
Right.
Why is that? I mean, at least if we're going to not be keeping our commitment to fully fund it, we should be funding it at the same percentage, so that no matter if it's Shrewsbury in my district or Westboro in my district, they're getting the same percent allocated to them.
Right.
And right now, that's not the way it works.
Right, it's an equity issue, and I think the fact
It
that
is.
obviously the regional transportation doesn't just apply to students going to vocational and technical
Right.
school, and you have to be part of a regional,
Yes.
but if you're a regional school district,
Yes.
like Wachusett or
It is a much
Neshoba
broader-
or Algonquin next door, and so there's a little more juice behind that,
Mm-hmm.
because there's a lot of districts with an interest in that, and a lot more money in that piece. So again, we very much appreciate the advocacy, and we spoke to Senator Moore. He came to school committee
Yes.
meeting last week, and he knows that this is key, and we're hoping the Senate again will bring some more dollars into that, and hopefully that'll be something in the next fiscal year that will continue to provide some relief for the local school
Definitely.
district and the community, which is terrific. In terms of places where state policy intersects with the needs of local school districts. And of course, one of the things about education is that there's virtually nothing to do with society that doesn't affect education in some way, shape, or form. And one of the things that has been a focus of our district over the past few years has been issues relative to health and well-being, students' mental health, behavioral health. And although we embarked upon that 5 years ago, it was a couple of years after that, where the opioid epidemic really started to amplify. That's something that has been devastating to families. It is tragic. It's something that I think rightfully so now has become maybe the major public health initiative that we've seen in the Commonwealth and across the country in different ways. I know that you've been involved with that a great deal. You're on a committee at the state level. I know locally you are as well. Could you talk a little bit about that work? Because obviously public health issues, that especially those that affect young people, but anything that affects families affects what we do in our schools. And so maybe talk a little bit about that and your involvement with our local initiative too, with the new SCAPE group that's
Yes,
emerged.
definitely. Yeah, when I was elected, the Worcester County District Attorney Joe Orley asked me if I'd be on the Central Mass Opioid Task Force, and I am on that, and I specifically serve on the subcommittee on treatment and recovery, which has been really eye-opening in many ways because, like many things, we have to make sure that we are caring for folks all the way through the process. And when somebody's in recovery, it's not necessarily the final step. They need support. The gentleman who heads up Spectrum, who is a local provider here, has been in recovery for 45 years, and every day it's an issue that he has to grapple with. So part of it has been helping people understand what the nature of the epidemic is, and also treating it much more from a medical perspective than sort of the stigmatism end of it, which has been something we suffered from in the past. But it's also understanding that this epidemic has correlations with the mental health of our students as well. And so one of the things that we know now is approximately 50 to 60% of people who have a substance use disorder also have an underlying mental health issue. And in the schools, we look at that in terms of children who are having anxiety issues or struggling in the schools. Sometimes they get introduced to an opiate through something that most people didn't recognize was dangerous, whether it was having their wisdom teeth pulled or having an injury and having pain medication. And sometimes the recognition that their feelings are easier to deal with in terms of whatever they're struggling with when they're using a substance has really made this exasperated, I think, specifically in the schools and for younger and younger kids all the time. For me as a parent and a resident of Shrewsbury, and I did get involved in the SCAPE, which is the Shrewsbury Coalition for Addiction Prevention and Education, because we are seeing this affect us on so many different levels, not just in the schools, but in our community as a whole. But part of our job is to not just make sure people understand there's an epidemic, it's to understand why there's one. And so we held a forum at the high school a couple weeks ago, which was very well attended. I think we had about 250 people there. And we had a good panel that represented sort of diverse perspectives and responsibilities in the epidemic, but really just trying to provide a level of education about here are some of the ways that, that students and people end up getting into this. Part of it can be simply they were prescribed something and then got addicted, because this is a disease of addiction. And some of us are unfortunately more prevalent to the addiction than others.
Right.
And then part of it is just simply some of the other pressures that are in society that people feel. And for that reason, opiates has become more addictive to many. We are doing work on the state level to try and take out of circulation more. I believe last year was 240 million pills were prescribed just in Massachusetts, which is enough for every man, woman, and infant to have 40 pills each.
Oh my goodness.
Half of that was prescribed from a dental perspective. And so part of what we've been doing is limiting, to the first prescription for a 7-day, and then you have to go back and have a conversation with your doctor about what's going on. Because if you truly need that much pain medication, there's probably also other things going on that you need to be addressing with your doctor, not just sort of physically covering the pain, but understanding why you're still in that situation. So taking out of circulation is important. The medical community is certainly much more aware of this and is doing a lot of work on their own to sort of make sure everything from checking the prescription monitoring network. So people who are sort of habitual users who are going doctor shopping essentially to get prescriptions, that's become more aware. But on the other side, we have to make sure that parents and educators and people who deal with students all day long also understand, the stress that they're under can lead to certain activity, but also ways to help point out if we're seeing changes in children. So I know that our guidance counselors, our adjustment counselors, our administrators, our teachers, our staff here are very aware of, understanding that if a child suddenly seems different than they were a short period of time ago, trying to raise a flag up and say, just want to check in and make sure everything's okay.
And when it comes to issues of potential substance abuse, typically that'd be more high school level. And I know that our Shrewsbury High School has a very strong, what they call student support team, where they're convening weekly with all those different players around the table, guidance counselors, nurses, administrators. Teachers can refer students to it. And of course, with the high school schedule, unlike having one teacher all day long or a few teachers, it might be one teacher seeing something. Well, they want to make sure the other teachers seeing this too. And then making an intervention plan that makes sense to work with the student, their family. Obviously we want to be as preventive as we possibly can. We've got about 1 minute left. So relative to that piece, I know that you're doing a lot of work right now relative to the ballot question in the fall on marijuana. So very quick bullet points on that.
Sure. Well, I would just say that, there will be on the ballot in November a question to legalize marijuana in Massachusetts. And it's a very long ballot question, and it was really written by the marijuana industry for the marijuana industry. So what I tell people is, philosophically, whether or not you're opposed to legalization is one question, but the question before us in November is whether or not this is the mechanism to do it. And so we're spending a lot of time out there talking to people about it because we're very concerned about the youth in particular. In all the states that have seen medical marijuana and then legalization of recreational marijuana, the youth use has gone through the roof. And so from that perspective, it's something that we want to make sure the parents, as well as educators and everyone else understands that, there is a great concern that we will simply be bringing more pot and more access into the schools, and there's going to be effects on the kids. And youth use is something that we need to be concerned about because it has long-term effects, both in terms of their development, their brains are still developing, and there's definite correlation between use of marijuana and brain development. But also because of the impacts later in life in terms of IQ loss potential from the use. So
there's going to be a lot of information coming this fall, this summer into the fall, all the way till the election in November. This will be a really important decision that's made at the ballot box. So appreciate you raising people's awareness of that particular issue. We are out of time. I'd like to thank you for being my guest, certainly. Thank you for the support that you're providing. As you alluded to earlier, the fact that not only are you a legislator, but you're a local finance official. You've been an officer in PTO. You're a parent. You come from an educational background, so you're able to see issues related to public education from a lot of different vantage points, and that really helps you have the perspective to be supportive and be very tactical about the way you go about that. And I really appreciate the work and the fact that whatever we have an issue or a question, you're there being willing to listen and advocate for our schools. So thank you for that, and appreciate it, and I'm sure there'll be lots of issues over time that we'll be having conversations about.
Thank you.
So thank you for tuning in to this episode of Superintendent's Update. Again, I'm Joe Sawyer, the Superintendent of Schools. Appreciate you watching, and thanks for your continued support of our public school district here in Shrewsbury.